Hi, everyone. This is Ted Goodart. Welcome to the Repair the Roof podcast. Today, we have a special guest. Laura Crouse is with us today to talk about Medicare, one of my favorite topics. Welcome, Laura.
Welcome. Thank you for having me.
Hey, you're a Medicare specialist, and I want to dive right into this topic today. What is your role as a Medicare specialist?
My role as a Medicare specialist is to go in and, look at every client as an individual. Everyone's needs are not the same. And so when you approach it, you need to know, what are their concerns? What doctors are important to them? What are their healthcare concerns? What are their long-term goals? What do their finances look like? That all plays a part in, fitting them with the best plan and kind of seeing and mapping out the year ahead for them.
So, what are the basic eligibility requirements for Medicare? Let's start with the real bottom line basics.
Sure. It is a federal healthcare plan, and typically you have to be 65 years or older. Now, there are circumstances to which you can be under 65, but typically you have to be 65 or older. You have to be eligible for Part A, which means you've had to work at least 10 hours full time or 40 quarters to be eligible for Medicare Part A. Now, you can buy your Part A premium if you haven't met those qualifications. You have to be a U.S. citizen or you have to have been a legal resident for at least 5 years.
So when you say Part A, what does that mean? It sounds like there are different parts of Medicare. So let's focus in on Part A. What is that all about?
So Part A is your hospital coverage. It is the part that automatically happens when you start to file for Social Security or that when you turn 65. So it covers things like home care, hospice, things of that nature.
And I take it then, in addition to Part A, there are other parts. Can we talk about that?
Yes. So there's Part B. If you are eligible for Part A, you are usually entitled to Part B. Now, there is a premium that comes along with Part B. A lot of people who decide to work after retirement or their normal retirement age will put off Part B because that is like your doctor's visits, your specialist, your medications. Um, and usually if you have credible drug coverage through your employer, you don't need Part B right away. So Part A is hospital and Part B is your medical.
So if you work after age 65, you're still eligible to go on Medicare. But as I understand it, maybe you're not required to, depending upon the size of your employer.
Right. I tell all my clients, you've worked for that Part A, so you should. So if you retire on time and you file for Social Security, like I said, it automatically starts your Part A. But if you decide to work, you still have worked for that Part A. But it does depend on the size of your employer. If you work for an employer who has less than 20 employees, you're probably better off going ahead and signing up for that Part A for sure. If you have more than 20 employers, your employer insurance will be your primary insurance. Your Part A will be your secondary insurance. But again, you've worked for it. So I always suggest or recommend that you go ahead and pick that up.
So in addition to the A and B, I think that's pretty clear. One's hospital, one's physician. I'll
Right.
kind of look at it that way. What other parts are there to Medicare? What else does it cover? Under what parts?
Are you talking about like, is there a part drug plans and Part
Yeah.
C? Okay.
Uh-huh.
So now we're looking at Advantage plans. So Part A is your hospital, Part B is your medical. What happens, or what kind of has happened over time, if you want to go back and look at some history, is that people used to retire with benefits for the rest of their life. And that just doesn't happen anymore, unless, of course, you're military. Those people get TRICARE for life, and there's certain government positions that, you'll retire with some health benefits. But when you retire now, you are relying on the federal health plan, and that just doesn't cover your expenses. It absorbs the cost of some of your expenses, but not all of your expenses. And to just kind of give you a glimpse, I think the hospital deductible, if you were going to the hospital and have a hospital stay, the deductible is over 1,600 for 2025. So if you can imagine, if you have multiple hospital stays in a year, that can be pretty costly. And that's not even including the doctors you're seeing, your medications, or anything like that. And your Medicare doesn't cover prescriptions. So that's a separate cost. So what happened is the federal government looked to the private carriers and they said, listen, we need help managing our Medicare system. And that's kind of how Part C happened. It's really not a federal healthcare plan, it's a private plan. You have to have Medicare Part A, which is your hospital, your Medicare Part B, which is your medical, to qualify for Medicare Part C. Those are your Advantage plans.
Now, in addition to then A, B, and C, is there a Part D?
There is a Part D, that's your prescription drug plan. You have to show that you've had credible drug coverage. There's also an enrollment period to where you have an opportunity to pick up that Part A and that Part D. If you don't pick it up in a timely manner, you could pay a late penalty. I've run across a lot of clients who, they retired, they weren't on any medications, they were healthy, they didn't feel the need to pick up a Part D, they were not informed. And so they went years without picking up a Part D or credible drug coverage. And they pay a penalty for that the rest of their life if they don't pick up that Part D.
So when should somebody think about applying for Medicare?
You know, I'm 54 and I'm already starting to think about, you get to a certain age, your kids are getting older, and then you start to think about that next phase of life. And I think it's good to start thinking about what that's going to look like for you, because it's costly, no matter what way you look at it, health insurance is costly. And it's hard even with, just a prescription drug cost. And a lot of these Part C plans are premium free plans, which means you're not paying anything for the plan. That doesn't mean there's not out of pocket cost. But the plans are free. The prescription drug plans are free, but you still have to pay for the prescriptions. You still have to pay for the plan. So I think it's, the earlier the better. You need to think about what your future is going to look like once you retire.
Well, when's the soonest I can apply?
What's the soonest you can apply for Medicare? You
Yes.
have the 3 months, you have a 7-month window. You have the 3 months prior to your 65th birthday, the month of your birthday, and the 3 months after your birthday to apply for Medicare Part A.
So you have a 7-month window to apply. And let's say I don't apply. And let's assume I don't have any coverage at all, no credible coverage. If I later want to join, am I allowed to join late? And if so, is there a penalty?
So you have an initial election period. If you miss that period, now you have to wait until there's an annual enrollment, which starts in October and ends in December. And yes, for every 12-month period that you go without enrolling in the plans that you should have, there's a late penalty.
Very good. So let's talk about original Medicare,
Okay.
traditional original Medicare,
Okay.
and then let's compare that to Medicare Advantage. And let's talk about what is the difference between the two.
Okay. So original Medicare is the Medicare that we're all, if you've worked, if you have a work history, and I should also say too, when we were talking about the eligibility requirements, if you're married and your spouse has that work history, that also makes you eligible for those Medicare benefits. Even if you're divorced, as long as you were married for 10 years. So once you turn 65, that Part A and that Part B is your original Medicare, and it pays for some expenses. I have a quick list here. So your original Medicare, you can use any doctor, you can go to any hospital system that takes Medicare. If you choose an Advantage plan, you're usually tied to a network. for cost savings reasons. And it depends on where you live. So what state you live in, what county you live in, that will probably dictate a lot of what network you're in. If you have original Medicare, you don't have to have a primary care. You don't have to have a referral for any specialty visits. If you have an Advantage plan, a lot of times that is the case. You have to choose a primary care. That primary care usually is the one that has to make the referrals to any specialist that you see. Also, with original Medicare and with Advantage, you have that Part B premium. That really doesn't go away. There are some Advantage plans that kind of cater to veterans, and they'll kind of buy back their Part B. The only other way that you're going to get your Part B premium paid for is if you are Medicaid. So your resources are limited. Your income, usually you're living in poverty if they're going to pay your Part B premium.
So on the, if I understood you correctly, and correct me if I'm wrong, so if I have original Medicare, and that means I have Part A and B, and if I want to cover some of the other costs, then I can come to somebody like you and do a Medicare supplement type plan. Did I understand that correctly?
Right, you can. Because your original Medicare, and I kind of touched on this briefly earlier. Your original Medicare does not come with a prescription drug plan. It is solely medical and hospital. So that can become pretty costly. So unless you have just a ton of money just to spend on your medical, you are kind of left within a situation where you've got to decide: do you want to go towards an Advantage plan with it, which is your Part C, or do you want to go towards a supplement plan? Because your original Medicare doesn't cover things like drugs. It doesn't cover dental. It doesn't cover vision. So
Well, it
those
does,
things.
but let me ask you this.
Mhm.
Does your original Medicare cover 100% of your physician bill, 100% of your hospital bill?
No, it does not. And so
So
when I was talking
what,
earlier,
so
go
what do you
ahead.
what generally do you tell people in terms of what it will cover?
It covers, you know, every year it's different. So like I said, for an example, like if you were in the hospital today, it covers about 80%. If you were in the hospital after your deductible. So if you went into the hospital today for a 60-day stay, you're going to pay $1,600 off the top. And that's just your deductible. After you pay your deductible, then it's covered. But that doesn't cover your doctors, your medications. That's an additional cost, on top of your medical deductible for your hospital stay. So the Advantage plans, they have a max out of pocket. So when you choose a plan, and the way I have patients or clients choose a plan is I have them look at their doctors. What doctors are important to you? What medications are you on? What medications do you have, to stay healthy? Then we look at, things like, their finances, because some people, they just really can't afford a premium. Some people know they're going to end up in the hospital 1 or 2 times a year. So we have to look at things like that to see what their overall costs are going to be for a year. So Part C kind of gives you kind of more security into what's the worst case scenario that's going to happen to me this year medically. Because with original Medicare, there is no limit. It doesn't stop. If you went into the hospital several times and it was more than a 60-day window, you're paying that deductible every single time you go into the hospital. At least with a Medicare Advantage plan, you know what your max out of pocket could be. You know what your worst case scenario is going to be.
Does the Medicare sup pick up that deductible at all, or is it after the deductible?
So now your Medicare supplement is a totally different plan. So that's considered like a Medigap plan. That fills in what traditional Medicare does not cover. I like Medicare supplement plans. You definitely have to plan for that in retirement because those come with a pretty heavy premium. You have a 6-month enrollment period where there's no underwriting for pre-existing conditions when you turn 65 or when you retire. so that it costs the same no matter what. Um, that totally fills in the gap. So everything that your original Medicare doesn't cover, your Medicare supplement will cover, but it's at a pretty heavy premium, and it also doesn't cover your drug costs. So in addition to the premium, you have to pay for a prescription drug plan. It
So
also,
let's break this down in terms of cost.
okay.
Let's compare it. So original Medicare, what are the normal charges that we have to pay to get Part A and Part B?
So you don't pay anything for the Part A unless you don't have the work history.
Okay.
You do have to pay the Part B, and it doesn't matter what plan you're in, you're going to have to pay that Part B premium.
What does that cost me?
This year in 2025 it's 185, and that usually goes up every year.
And I assume that, as I have found out, that if you're still working, you may have to pay more than the 185.
Right. That is totally based on your income. So most people pay 185. You can get online at Medicare.gov. It'll show you because it changes from year to year. I think the max is if you're making more than a half a million a year, you're claiming on taxes. It can run you over $600 for that Part B premium.
So Part A, no cost. Part B, we pay this, let's say, $185 premium.
Hmm.
Then we want to add a Medicare sup. What is the range of price that we're going to pay for a Medicare sup plan?
So, it's Medicare Sup is interesting because there are usually about 10 plans and they're all designated with letters. Those plans, so one of the popular plans is a Plan G. It is a Plan G, whether you're in Ohio, Indiana, and it covers the same things. The policies are pretty much the same. It just depends what carrier you go with, what private carrier you go to. I have seen MedSup plans under 100, and I've seen them over 300. So it's customer service. They're about the same. I really don't know why someone would pay 300 instead of 100, and they change from year to year. But a Plan G is a Plan G, no matter where you're at, no matter what state you're in, and it covers the exact same things.
And when we're talking 100 to 300, we're talking per month, right?
We're talking per month,
All
right?
right.
And then
So, so,
you have the prescription drug plan too,
so
which
let's talk
those
about that.
prices are going up as well.
So what are you saying in terms of pricing a Part D plan?
So they were expected to triple last year, but they didn't because the federal government kind of stepped in and said, "Hey, let us help you with these prescription drug plans," so that it wasn't such a shock. The numbers are just now coming out. I haven't seen them all. They just actually some of them have been released just earlier this week. They're expected to triple. Last year, I saw prescription drug plans range from like $35 to 70 some dollars. They're expected to go up to about $120 for a prescription drug plan
So that was 35 to 70 per month, right?
per month on top of
Yeah.
the supplement plan. Yes.
All right. So if we're going to stick with original Medicare, we're going to get Part A coverage, Part B coverage, and then we're going to do a Medicare sup to cover the things that A and B don't pay. And then
Right.
we're going to end up with a separate prescription policy under Part D. And
Right.
we pay $185 for the Part B. We might pay up to $100 for the sup, perhaps, maybe
Hmm.
more. And then Part D, somewhere between $35 and $75 currently per month. So you add all of that up, and that gets to be a pretty significant amount to stay with original Medicare. So
Right.
I guess the alternative that is out here in the private sector, in the private insurance market, is what you were referring to as Medicare Advantage plans.
Yes.
And those Medicare Advantage plans necessarily include A and B coverage.
Yeah, it has to, you have to have A and you have to have B to participate in an Advantage plan.
So what
And
are we
typically
seeing in
those,
terms of costs for the Medicare Advantage plans? And is it wide and varied? And how many companies are there out here in the marketplace that are offering the Advantage plans?
so there are a lot of companies. I currently carry 10 private carriers.
Okay.
There are well more than that in the state of Ohio. I carry the major ones and then the ones in Dayton. They vary in price. You can usually find a no premium plan, but it depends on the type of plan that you get that can maybe sometimes dictate the cost of that plan. But these plans, you've all seen the TV commercials that promise you dental and vision and grocery money and transportation. At the base of all of these Advantage plans, at the bare minimum, they have to offer you at least what Original Medicare offers you. So when that conversation happened, the federal government said, you can manage these, but you have to at least offer them the at least what Original Medicare offers. After that, you can give them whatever you want, but at the bare minimum, what Original Medicare gives you. So you have to have your A, you have to have your B. Most of the Advantage plans offer a prescription drug plan. There are some that don't, because there may be somebody who has a prescription drug plan through maybe their spouse, so maybe they don't need a prescription drug plan. But most of them have a prescription drug plan embedded in the Advantage plan.
So help
And
me understand the pricing structure on the Advantage plan when you were saying there's no premium. Help me understand how that could be possible.
okay, so most plans have no premium. There are plans with premiums. Most of my clients, can find a plan without a premium, but that doesn't mean that you don't have out of pocket cost. Your drugs still cost money. You have what's called a MOOP, a max out of pocket cost. And so, you may be comparing two plans, and in one plan, you might have a max out of pocket of, you know, I'm just going to throw out an arbitrary number, like 3,400, because that was one of the lowest out of pocket plans. That's there. And this is an estimate. This is that they base it on like a visit to the emergency room, a week in a hospital, basic medications, a visit to a doctor, a visit to a specialist. That's how they come out of, kind of come up with these numbers. All of them have a catastrophic of 8,500, 8,500. So at least you go into the year knowing that you'll never pay more than that. And for just maybe one hospital stay, worst case scenario, maybe your max, they anticipate your max out of pocket being like 3,400. But you might have another plan without a premium that the out of pocket costs are 4,500. And you got to look at those plans and see, why is that so? It could be the type of plan that you're in, because there's different types of plan. It could be that this plan is giving you all these bells and whistles, and they're enticing you with this food card, but this plan is just giving you the basics. Like, they're not enticing you with this big money card or all this money in dental. They're just saying, hey, listen, we're going to give you the lowest max out of pocket, but we're not going to give you all these bells and whistles that they're promising you on TV. So you've got to kind of really look. I think it's as easy, especially with the senior population, and especially people who are, they're strapped for money and they're living paycheck to paycheck. When you hear the promise of $100 food card, sometimes you don't look at the whole entire picture, and you may pick a plan that, potentially could cost you more out of pocket at the end of the year. So you really have to look at the entire plan.
It sounds complicated to be able to analyze whether I should go on original Medicare or Medicare Advantage. And then within the multiple Medicare Advantage plans, if I decide to go that route, it seems challenging. So what I take it is that you're there to help guide people through all of these decisions based upon their current situation.
Correct. It's definitely not everyone fits in one box kind of situation. It is, and it can even vary from husband to wife, depending on which plan you're putting someone in. A supplement plan is good if you're getting ready to retire and you're someone that has saved, and you can afford those premiums. A Medicare supplement's great because you can take that plan anywhere in the United States. You can go to any doctor that provides Medicare services. If you're more strapped and you're not someone that's going to travel and you really can't afford a premium and maybe you've got some health concerns, then we're going to look at maybe something different, because underneath the umbrella of Advantage plans, there are different types of plans that may work with you. And the other thing too is a lot of these Advantage plans are becoming a little better as far as portability, being able to take them other places beside your network.
Well, that is probably most people's biggest concern is what happens when they got to go out of network.
Right.
What does that look like? What do they have to do to be able to go out of network? And what happens when that occurs?
So any emergent care or any urgent care is covered. Now, it will probably be at a higher cost sharing because you're not in your network, but it is covered. And then depending on the plan, and again, every plan is very specific and it will spell out to you like what happens if you are to receive services or dialysis services or any kind of medical services outside of your network. You can go outside of your network, but it is typically going to be at a higher out of pocket network cost to you.
So I guess you got to have somewhat of a crystal ball. Having said that, if I start off with original Medicare and want to switch to an Advantage plan or vice versa, start off with an Advantage plan, but think maybe I should have been on original Medicare, are you allowed to switch back and forth, or are there some limits on being able to do that?
You can switch back and forth, but often there are enrollment periods in which you can do that. So it just depends on the circumstance, but there are special election periods that allow you. If you are an original Medicare and annual enrollment is over, no, you can't switch at that point. You'll have to wait until the next enrollment period. It depends, a lot of it depends if you're going from supplement to Advantage or Advantage back to supplement. But there are, that's when you need to talk to an agent, because there are special election periods. There are times where you can, if something wasn't working for you the way you thought, you can go back to your original Medicare.
Do any of the policies, whether it be original Medicare or Medicare Advantage plan, do any of them require any kind of medical underwriting, or are they guaranteed issue?
So, the Medicare Advantage plans don't require any underwriting at all. You just have to make sure that you're eligible for A and that you've picked up your Part B. Now, your Medicare sup, if you do it within the first 6 months of retiring or of 65, there's usually there is not any underwriting for any pre-existing conditions. Now, I've heard different things. I've not run into it myself. I have been told, for people who are still, working, not to pick up their Part B right away, because that sometimes can start that clock of that 6 months. And, you don't want to mess up any issues with underwriting if they decide they want to go with a supplement plan after they retire, if they've decided to work after retirement age.
So does that mean that if somebody has gone on original Medicare, does a Medicare sup, and wants to change out of that Medicare sup, they might be subject to underwriting with any new company? Does it mean that?
Yes, it could. Or like if you went from a Medicare sup and then you decide to go to a Medicare Advantage and then all of a sudden you want to go back to a Medicare sup, then you're subject to underwriting.
I got you. Very good. Let's talk a little bit about something near and dear to my heart, and that is uh, somewhat related, but a little bit different. Let's talk
Okay.
about Medicare long-term care coverage
Okay.
before we wrap this up. What does Medicare typically provide coverage for as it pertains to long-term care?
They don't pay for anything. Medicare is a federal health plan. And, I am also in the healthcare field and I see this all the time. I just read an article recently and they cited that 60% of people who retire believe that there is some sort of built-in long-term care for them in their Medicare, and that's just not the case. Medicare is healthcare. It is it is the system that provides you skilled services, your nursing services, your doctor services, your medications, well, not your medications, but your medical. Um, Long-term care is custodial care. It is helping you with your activities of daily living, like your bathing, your dressing, your toileting, homemaking, adult daycare. Those are two separate things.
So I suspect, I guess Medicare will pay for hospice care at the end of life if we're terminal, but you
Yes,
got to be terminal to get that. So that's really
right,
not custodial care.
right.
Um, the only other thing I can think of where Medicare may enter into it is for my clients who go in the hospital and maybe need some rehab for a short period of time. I guess Medicare will pick up the rehab.
So they'll pay for rehab because it's skilled. They consider that skilled care. And they're not going in there just to receive custodial care. They have to require the skill of either a nurse or a physical therapist or an occupational therapist. I work in home care and we do provide aides that will come in. Our aides aren't aides that come in and, are with you 3 or 4 or 5 hours a day or every day. Medicare says, hey, you were in the hospital, you were ill. We understand that you need some skilled care. So, you have a nurse out there, a physical therapist, and maybe they'll pay for an aide, but that aide can't stand alone in that house. That aide can only be present with skilled services of a nurse therapist. So once the skilled service stops, once the patient doesn't need the nurse anymore, once the patient doesn't need any rehabilitative services, that aide has to leave as well. They can't coexist. They have to coexist together. They can't be alone in that home. It's
That's really,
short-term care.
yeah, that's important for everybody to understand. When you look at the what's happening in the country today, and you're looking into the future, are companies kind of going in and out of the Medicare Advantage world? Do you see that happening in any significant way?
What do you mean? I'm
Companies insurance companies like, say, CareSource or somebody like that that's providing Medicare Advantage. Do you see any of those companies maybe entering the marketplace or leaving the marketplace? Is there any concerns about that?
I haven't seen any, I there's it's lucrative for these private insurance companies for clients to choose them to manage their healthcare needs because the federal government sets the money aside for those private carriers to take over the management of their care. I it seems like it's not going anywhere. This is the way it's going to be. I don't see Advantage plans going anywhere. I think they're here to stay. I think that people are not most people are not in a financial situation to pay the heavy cost of supplement plans and the rising prescription drug plans. And this is the only way that they can manage their care.
If you were going to project the future, say over the next 2 or 3 years, do you see any major changes?
I do in the supplement world. I mean, I guess that's to be seen, but those prices are expected to continue to go up. But at the same time, we've been hearing as well that a lot of these advantage plans are gonna, they see what the client needs, they hear what the client needs. You know, Clients want to be able, they don't want to have to stay in their network. They want to be able to travel to Florida. They want more portability in their coverage. And so I think we're seeing a little bit more of that too. We're seeing them kind of create plans and become more creative, not that they're supplement plans, but that they kind of more mimic a supplement plan and give you a little bit more freedom and flexibility in your plan without it being a supplemental plan.
Well, very good. I see we're out of time here, Laura. If individuals would like to contact you to talk about their choices for Medicare, how would they go about that?
You can call me at 937 And I also have an email. It's LSCROUSE, that's Crouse, 1227 at iCloud.com.
Great. Well, Laura, thanks for being with us today. I really learned a lot. I always appreciate those who can educate me so I can help my clients. Because at the end of the day, I know that's the business you're in and that's the business I'm in, is
That's
trying to
right.
help our senior citizens make better decisions. Thanks so much for being with us.
Thank you.